We're two doctors with over 40 years of medical experience between us, and we're going to tell you what health items we take with us when we go on vacation. Hi, I'm Dr. Sean Miles.
And I'm Dr. Bill Fricks.
So what we're going to talk about today are things that may make your vacation stay a little bit better, health-wise.
We're talking about medical items that you may forget, may not think of when you leave for vacation. There are a few necessities like underwear that we'll leave to you.
There is one item that I never go on vacation without. I think I've told you before. Benadryl. Diphenhydramine is the generic name for it. Benadryl is used for lots of things. The most common being
Itching.
Itching and allergies. They kind of go hand in hand. It's sold in the allergy section of the pharmacy. But there's some other things that I like to use it for sometimes. Sometimes when I'm out of town, I might find trouble sleeping. So sleeping, it works great for insomnia.
Especially if you have some kids, take a little Benadryl, go right to bed. Or better yet, give them the Benadryl and go right to bed.
He's kidding. Maybe. And along with the runny, stuffy nose that you get with allergies, maybe you get a cold. And taking a Benadryl can help dry up the runny nose to make it a little more tolerable. Another thing that it can be used for that some people just don't know about, nausea.
So going along with that, when we're on vacation, we tend to be eating things that we don't normally eat. One of the things that I usually recommend that people take are some Tums.
Tums, that's right, calcium carbonate.
You want quick action relief from those things, right. And so Tums is probably a good way to get.
Sometimes when traveling, I get an upset stomach with diarrhea. Is there something I can pack for that?
I think that there is an easy thing that people should take with them in that situation.
A Modium.
A Modium. It's fast-acting too, very few side effects. And I think it's good as long as you're a good candidate for it medically.
No fun to be on vacation with diarrhea.
No. Now, if you're traveling out of the country, I read a study one time where probiotics, taking it and starting it before your trip, can actually reduce your incidence of traveler's diarrhea by 80%.
Excellent. How about moving on from the GI system?
One of the things I see on vacation, I see myself doing a lot of, I'm doing a lot of activities that I don't normally do.
Used to be the weekend warriors, now it's the vacation warriors.
Vacation warriors.
Yes.
So there's a lot that kind of goes around that. I think certainly injuries.
Injuries. Yeah.
Injuries, we have to be aware of injuries. So if you're the type that will dive for the volleyball, I think Band-Aids are important.
Oh, yes. You need a clean wound and cover it with Band-Aids.
And along the same lines, I think we talk about maybe bringing some polysporin.
Yeah.
And doing maybe a little exercise before you go to the beach.
Yes, but let's say that you do have a little muscle soreness. Mm-hmm. Is there some other medicine that we could take that might help with that?
Yeah, I think an anti-inflammatory, something like ibuprofen. I tend to lean more towards Aleve because it's just twice a day.
Yeah, Aleve, which is naproxen, may be even a little safer on the heart than ibuprofen.
Other things. What else would you bring on this vacation?
Well, I think it depends on a little bit where you're going. Like if you're going to the beach, there is no way this fair skin is going to go without sunscreen. Just no way. I will burn to a crisp, and I don't want to get skin cancer, so I'm going to try to help protect myself and use that.
We would not be doctors if we didn't recommend you wear your sunscreen.
There's different types of skin cancer that can be brought on by UV exposure. Wrinkles. Nobody wants wrinkles.
Yeah, I think we're more afraid of the wrinkles than the skin cancer sometimes. What about if you're going on a camping trip, going out in the woods,
Playing with the ticks. Is that what you're?
Playing with the ticks.
Ticks, mosquitoes. That's right. I like a good insect repellent, and there are lots to choose from. The one that is recommended by most medical societies contains DEET. I know there's plenty of other ones that are considered natural, but the DEET ones have definitely proven themselves to be effective. And if you're going somewhere out of the country, you don't just need something with DEET.
If you're traveling out of the country, you need to do a little research beforehand. So the CDC has some good websites for travel medicine, and recommend you go there and see what vaccines you need, what antibiotics you may want to take. There's sometimes medications like malarial medications that you'll need to take too.
And since we're talking about insect bites, if you happen to get some insect bites, taking a little hydrocortisone cream along with you can be beneficial.
That's one of my favorites. Great for bug bites and any kind of itchy rash. Would not use it on wounds.
I've got a question for you, Dr. Fricks. I have Plenty of patients who are going traveling, whether it's out of the country or within the country, say, hey, can you give me XYZ antibiotic to take with me?
Would love to give it to you. We always look to please patients, but it is not recommended. When they've done studies, they found that people usually take them for minor issues, and there's a little overuse and places them at risk of contracting resistant bacteria, and best to kind of stay away from that. But that's between you and your doctor. Talk to them. For respiratory infections and things like that, unless you're going to the Amazon or deep in the Sahara Desert, I think you're best just to take this list of medications that were recommended to you today.
I think, antibiotics, while great, and they definitely have their purpose, if you're traveling a lot and getting respiratory infections, most of those are viruses, and viruses are not treated with antibiotics. Besides just resistance with the germs and everything that we see, you can have some real serious side effects that actually can kill you. So don't just take antibiotics at the drop of a hat. Make sure you have a good reason to.
I think this is a good lead in to our last item, medications.
Oh, yes.
Yeah. Do not forget your medications. And I think the ones that I typically forget are the as-needed ones, the ones that I rarely need to use. The migraine medicine, maybe the gout medicine, the asthma inhaler. Make sure you think through those and make sure you take those with you, because you never know when you might need that EpiPen or
Oh, yeah, don't forget that.
or something else.
Dr. Fricks, we have talked about a lot of different things that maybe we can take with us. I think if the casual listener was listening to this, they would think we need to take a whole separate piece of luggage just to contain all these things. What would your advice be as far as quantities to take?
All of them pretty much fit in a gallon Ziploc bag. So I don't think it's not, we're not talking about a lot. A lot of these things come in little small tubes.
And when it comes to over-the-counter medicines, I don't think, as long as you know what they are and there's not going to be any doubt about it, you don't need to take the whole bottle with you. On the other hand, I think if you're taking prescription medicines with you, it is important to take those.
Yeah, don't pull those out of a Ziploc bag unless they're required bottles.
Yeah, I think small quantities, gallon. I was even thinking a lot of these things could, except maybe with a sunscreen, fit in just a quart-sized bag.
Yeah.
So we're not talking big things. We're just talking a few of each thing. So maybe for Band-Aids, you just take 3 or 4.
So, Fox, looking at the things that we just talked about, are there any things that surprised you about that list that you did not expect to see?
You know, I thought prescription medicines, because normally people don't forget things like that, but I had a friend once that left their EpiPen at home, and that was a disaster.
And also, Fox, is there anything on the list that really hits home and you say, oh yes, I always pack that too?
I always remember my insect repellent, especially my flea and tick collar.
So thanks for watching today. Hopefully this video has been helpful and that you will remember some of these items.
Just don't forget to pack them.
Just don't forget to pack them.
If you have any comments or questions, please head down to the comments and feel free to list. We'll be glad to get to those.